It's making a difference in a small way now, but we're on a path to make a much bigger difference. This is an issue that literally millions of people are interested in.
Last year I was at the Elder Friendly Futures Conference at the University of Washington. I asked a question about were there any models of bringing together this sort of great untapped resource of retired healthcare professionals and matching those with folks who need help with navigating the healthcare system. People kept coming up to me and giving me their card and say, "Call me, I'm interested in this."
It was wonderful that a group of colleagues and volunteers in the community came together, and we all had a similar passion and idea, a thing that we wanted to create. In the process, we created a training manual and program. It was completely voluntary, and in the process 6 or 7 volunteers were trained, and those volunteers are out working in their respective communities and helping people navigate health systems.
We really took in a bunch of different perspectives from all the people in the task force who were coming from very different areas, but all had really valuable knowledge. And we struggled and tried to define things and had disagreements about, well, what's really important, what's core to this, and what can you ask volunteers to do, what's reasonable. And so we came up with, not the only way this could be done, but I think we came up with a good consensus on, here are things that are really going to help people.
And it's an opportunity for learning on both sides, as a volunteer and as a patient yourself. So it just fits so well with the needs we have for our complicated medical systems, to have real people be involved, taking care of themselves and helping each other.
This is a training that I need because I know I can be effective, I know I can be useful, and I know that we will have measurable skills for the client's welfare and benefit.
Not only did we learn some skills and gain some knowledge, but we also have some tools that I think we'll be able to disseminate to people to sort of share the wealth.
And help others with the same way that my husband's going to be needing help. I'm going to be needing help pretty soon, so I'll need to understand it. And he's 74 now, my husband, and I'm 60, and we live in Shag. And I communicate with a lot of the people there. I hear their ills, you know, and their woes, and I try to help. But this is helping me right now, coming to this session.
In our communities, because of the way that they're set up as independent apartments, neighbors often help neighbors, which creates a secure and safe environment for the residents living there. So for us, it's a win-win situation because we're creating meaningful volunteer opportunities in our communities and then also providing a much-needed resource for our residents.
So NEST is the organization that I work with, Northeast Seattle Together. Or hear from our members that process gives them more confidence going to the doctor, and just so they feel like they're not alone in managing their health care.
I would say don't worry about making this perfect. It will evolve as it evolves once you're through with it, so get it done. Make it happen, get it done. That was one of our principles.